more than halfway through American Heart Month, and you've already been hearing reminders all the time about preventing cardiovascular problems and cardiovascular disease. Well, today we're going to talk with some folks, one you know very well, one you're about to meet. One, Brandon Butcher, about his recent heart scare, and then two of Brandon's healthcare providers will be joining us. Marshall University Health cardiologist Dr. Andrew Vaughn is joining us right now. Dr. Brittany Messer will join us shortly for another discussion. But Dr. Vaughn, appreciate you joining us. I guess I have to say, Brandon, thanks for joining us. That seems awkward to say since he joins me every single morning. But one of the reasons that we've asked both of you to join me is because of the scare we all went through right here in this very studio. And for our viewers who are not aware of this, explain what happened to you, like right over there.
It happened on the air, just about. I had to step off camera because of what was going on to me. I didn't know what was happening next, kind of thought. Essentially, I started feeling some of these pains that you hear about. One was in the back of my shoulder, and then it kind of went to the front of my chest during the morning, and I just kind of brushing it all off because I'd never had these experiences before. And then all of a sudden, right at the end of my shift just about, I couldn't really breathe that well. I was losing strength on my left side of my body, and I didn't know what was going on. I decided to step off camera. Fortunately, we eventually got me to the hospital really quickly there, and I expected to be back on the air for midday, just get checked out, but they said nope. Not going to happen. I went immediately into the emergency room. They checked me out, and fortunately, it looks like I narrowly avoided a heart attack, but I had what was called unstable angina, or whatever, however it's pronounced. But the doctors, hearing my wife say that I have a history of ascending aortic aneurysms in my family. My dad had it and the like. The doctor immediately, instead of just releasing me with some medication, immediately said, you know what, we're going to take some tests. And I had a CT scan for blood clots, and that was okay. Had a chemical stress test, and that showed that there was something going on with my heart, and it led to getting a heart cath. And that's when, bringing in the doctors, that's when they discovered some things.
Well, and first of all, again, we're dealing with all of our viewers who are not necessarily as well versed as you are. Just explain basically what kind of the heart disease and cardiovascular problems we're talking about.
Well, we're talking about blockages, really, and that's usually cholesterol buildup or plaque inside the lining of the arteries that actually feed the heart muscle. We call those the coronary arteries. And those are the pipelines that supply oxygen and blood to the heart when it's pumping, and it needs that continuous flow of oxygen. Otherwise, you start having symptoms like you had. And fortunately, you recognize that as being something abnormal and didn't ignore it.
It was definitely not normal at that point.
Right.
Well, and he ended up going through some pretty serious surgery on this.
Well, but that's what he needed, though.
Yeah, the heart cath discovered that I essentially had those blockages, right?
Right. And actually a blockage in a critical artery, the left main artery. And that's an important artery because that supplies well over half of your heart with blood.
So part of what this also plays into is something that I also want you to explain to the viewer, lipoprotein A. Explain what that is, how this played in, how people need it to be in control.
We've known for a long time that cholesterol buildup is at the root of what causes this plaque. And there are various forms of cholesterol that circulate in the blood, but cholesterol doesn't circulate in isolation. It's encapsulated in a protein matrix, and there are various sizes of particles that circulate and various types of particles that circulate. And one of these has been actually one we've known about for about 60 years now. It's called lipoprotein a. It was discovered by a Norwegian scientist when he was studying LDL, which is the bad cholesterol. But he discovered this one, as you can see on the graphic. The core of it is LDL, bad cholesterol, but it has this extra tail of protein wrapping around it that adds really unique problems with this. It's really a triple threat cholesterol. It's got bad cholesterol at its core, which promotes plaque. It has this tail of protein on it that actually interferes with the body's own mechanism to break down clots. And finally, when it does wind up inside the lining of the artery, it promotes inflammation, which is really what is at the core of coronary artery disease. So it's a triple threat.
We're also in our next segment going to talk more about what are proper levels and et cetera. But also tell us during Heart Health Month, how does this play into diet? How has his diet had to change?
Well, you know, most people, particularly young folks as yourself, who've had heart trouble, we really want to reduce their risk. Diet is a fundamental aspect of this, but medications as well. Unfortunately, for this lipoprotein little a, you can exercise all you want, you can diet all you want. It doesn't influence this. This is a purely genetically determined molecule of cholesterol that is pretty much persistent at its level throughout life. We don't know why we have it. There may be some you know, protective mechanism, but we don't know. People who don't have elevated levels don't have any problem or health problem. But about 1 in 5 Americans do have an elevated level of this particular cholesterol form, which makes it the most common form of cholesterol abnormality that humans have.
I think that
one of the things we talked about with him is he should be too young for this. And what you're saying is that's not true.
Well, this particular form of cholesterol actually does help promote heart disease at a younger age.
Yeah, and I think that's another point to stress, because I already did the diet and the exercise things, and I technically shouldn't have been in these risk categories, but I didn't know that I had elevated levels of LPA, and nobody is going to know unless they get tested for it. And more than likely, your parents never got tested for it, so you don't know you have these genetic things because it wasn't really out there a whole lot. And it tells my cholesterol to be extra sticky, what little I even might have had or not had. So getting tested for this kind of thing might be able to solve a lot of problems, because it'll put you ahead of the game instead of having to work backwards like I have to.
And genetically related means your family has been tested too, then?
Well, my brother has gotten tested. We haven't tested my parents at this point. You know, they're a little older at this point. But my brother, he found out he had it. So it's something that, you know, you just didn't know in advance. And now that we do, I mean, fortunately, his cholesterol has been regulated a whole lot. Mine has to be now. This is something, again, when your primary care physician says, hey, you exercise, you diet, you're in a low risk group. Well, now I'm not. And I'm not going to be able to get over this just by diet and exercise. I need the right medication as well.
And I think the good news, Rob, is that while we don't now have a medicine to lower Lp(a), there are 2 major trials in the works right now that are going to report early next year that will identify and actually hopefully prove that lowering this triple threat cholesterol will actually improve outcomes and prevent heart attacks, prevent strokes, prevent the development of vascular. We are awaiting this.
Go back to my normal diet.
Well, Dr. Baum, we appreciate you joining us. We're going to take a break. We're going to have another expert who also worked with Brandon, Dr. Brittany Messer, come in and also talk about some of the other associated things with Brandon. But stay with us. Thank you, sir.
Thank you.